I met Joe when he was an air traffic controller with the military, and I was with the base operations. It was kind of love at first sight. He did 6 months in the Middle East before we came to Winnipeg. When I retired, we moved out to the country. We were right on the water. We had a beautiful A-frame. It was just absolutely gorgeous. But unfortunately, the first year we were there, Joe had a massive stroke. So it was tough. When I started having some back issues and wasn't able to do the work, then we had to make a decision to move back to Winnipeg. And that was a great decision too, because we have 2 beautiful grandchildren and our daughter is here. My husband has other things, not just his arm, and he has other health issues. And he's just not somebody that you can say, somebody else, can you take him for a day or so? I worried about that from the moment I fell. I knew this wasn't going to be an easy thing. I just knew it. We were coming out of a dance studio, and I'm trying to open the door. It doesn't have a window, so you can't see. And there was a gentleman coming in. He opens the door quickly. I'm trying not to trip over my grandchildren who were in front of me, and I just went flying. And I landed, and when I landed, I went down just like this, and I heard it break. I knew it was broken. I didn't even have to look at it to know it was broken. They did the x-ray. It was fractured and dislocated. So that it would definitely be surgery, and it had to be done by a plastic surgeon. I was worried about how many days would I have to come and sit around and wait? And how was I going to get the care for my husband? He has health issues that need attending. They're very personal to him. I worried about what was going to happen.
Right now, if you break your finger, then you end up coming to see us up in the plastic surgery clinic. You get the diagnosis, but then you wait on the list to be operated on in the main operating room. And every day, you're waiting for the phone call to come in to get your surgery done. You can't eat while you're waiting for surgery, so these patients are kind of going through a cycle of days and days without eating and days of not actually getting their hand surgery done. And that can be a real problem for patients and really stressful for them. So basically, the patient comes in, we see them in the plastic surgery clinic, and we operate on them the same day. Hopefully within an hour or 2 of them actually presenting, and then we send them back home with their splint, and it's much more efficient for the patient. Building this procedure room in our plastic surgery clinic is really important. It'll have far-reaching benefits for a large number of patients that we treat: trauma patients, skin cancer patients, burn patients, breast cancer patients. They'll all benefit from having a facility where they can be seen in a more timely fashion, where they can be operated on more efficiently, and where they can actually get better outcomes as a result of that. And it's much less expensive for the system because we don't have to involve the operating room where we're putting patients to sleep. We can do the same procedure just under some freezing without an anesthesiologist. So there's significant cost savings by having an operating procedure room in the plastic surgery clinic. There's a lot that we can do more effectively and more efficiently for these patients with help from donors.
We've been together for a long time, and it was important to me to be able to come home. When they said that I was going to see a plastic surgeon, it was unbelievable that it could happen that quickly. I was very relieved because I knew I could come home, and he was very happy. I could just tell when I walked through the door. It's so important for us to donate so people can get back to their lives like I did.